Good afternoon. Welcome to the Thurston County Board of Health meeting for Tuesday, June 14th, 2022. It is 3:31 p.m. My name is Ty Menser, Chair of the Board of Health. Participating virtually is Vice Chair Commissioner Gary Edwards and Commissioner Carolina Mejia. We have our County Health Officer, Dimiana Abdumalik, virtually as well. In the boardroom is County Manager Amira Chavez, our Interim Public Health and Social Services Director, Kurt Harden, who is our Administrator for the Board of Health, and Jamie Caldwell, Clerk of the Board of Health. And we do have a few staff for particular items that are on today's agenda, but we're going to call this meeting to order and begin by approving agenda and board meeting minutes. Is there a motion regarding the agenda? From Vice Chair Edwards, can you hear me okay? Sound check?
Maybe Commissioner Mejia can take that.
Go ahead and make the motion. I would move to approve the meeting, to approve the agenda for June 14th, 2022.
Okay, I will second that. And Commissioner Edwards is, I know, in transit to an event where he's speaking on behalf of the board for Flag Day. So we'll just hope that he can catch a good chunk of this meeting. But I'll call on you, Commissioner Mejia, for kind of acting vice chair duties. Okay, so there's been a motion and a second to approve the proposed agenda. Any discussion?
No, sir.
Call for the vote.
Commissioner Edwards excused. Commissioner Mejia?
Aye.
Commissioner Menser?
Aye. A motion carries 2-0. Agenda is approved. Regarding board meeting minutes from May 10th.
I would move to approve the board meeting minutes for May 10th, 2022.
I'll second that motion. There's been a motion and a second to approve board meeting minutes from May 10th, 2022. Any further discussion?
No, sir.
Call for the vote.
Commissioner Edwards excused. Commissioner Mejia?
Aye.
Commissioner Menser?
Aye. That motion carries and the board meeting minutes are approved. Next is proclamations and presentations, and we have two items under this heading. The first is a proclamation for Post-Traumatic Stress Disorder Awareness Month. We have as a guest today, Keith Meyer, Mental Health and Veterans Court Program Manager, and he has a couple of guests with him. I'm going to call Keith forward to the podium, and then we'll just kind of, whatever, Keith, you'd like to give us by way of introduction, introduce your guests, and we'll just proceed accordingly.
Thank you. Thank you for having me. I just want to make sure everyone can hear me okay? Okay, great. My least favorite subject to me, so I'll talk about me briefly. So I'm Keith Meyer. I'm the program manager for Veterans and Mental Health Court. I've been in the mental health field for about 30 years, specialized in the area of trauma. Had my own private practice, did trainings and consultations, and love mental health court and veterans court. So when the position opened, took my huge cut in pay and came to the county, which I'm very thankful for, and I'm glad to be here. So with me, I'm very proud and thankful. We have Kyle Putman. He's going to talk after me, and then we got Paul George, who's going to talk after Kyle. So when I was thinking about presentations and talking about PTSD, I'm thinking, okay, how do I get something I usually talk about 3 to 4 hours about in about 3 to 4 minutes? So we're going to get the real nutshell version. The first thing I can't say enough, thank you. I mean, from the bottom of my heart, thank you. Anytime we increase awareness, anytime we can talk about something in a meaningful, productive way, that helps other human beings. So the proclamation is near and dear to my heart. I know people who are impacted by PTSD every day. You won't see them. So one of the first things that we acknowledge with PTSD, it's an invisible condition that you won't see readily. So one of the things that we want to understand with PTSD is just of it in general. I promise not to give you a bunch of numbers because numbers are actually skewed. There's a lot of populations that are not properly represented in those numbers. So what we want to understand is it starts off with obviously a trauma event. Something horrific happens to someone. And it could be unexpected death of a loved one or a really bad injury to a loved one that you didn't see coming. So when we have a trauma event like that, what happens is people enter something called psychological distress. And psychological distress is basically, in a nutshell, how does trauma affect a human being? So we look at how does it affect them emotionally. So you can get feelings from anxiety, fear, aggression, or anger, to the other side of the spectrum where someone is distant, aloof, detached, numb. So when we have psychological distress, one of the ways that a person can be impacted is through emotions. They can be impacted with themselves mentally from the result of the trauma, like memories can be difficulties making decisions, poor concentration. Another area of psychological distress is behaviors. How does trauma affect someone's behaviors? You can have people become isolated, self-medicate, things of that nature. The last area of psychological distress is how does somebody get impacted physically? So what we can see with trauma is people's heart rates can increase, their breathing can become shallow, things of that nature that can lead to medical conditions like hypertension. The important thing with psychological distress, instead of throwing a bunch of information at you, it is a normal reaction to an abnormal event. So what I mean by that is something awful happened to you, and you did your version of, oh, okay, past assault, that wouldn't be healthy. There would be something wrong. So when people go through a hard time, of course it impacts them emotionally, mentally, some people spiritually, behaviorally, physically. So what we want to understand, it's a very normal reaction to an abnormal event. Now, if we start to have those reactions become more severe, more frequent, lasting longer, more tense, we start to move from reactions to symptoms. And now we start to have symptoms as a result of that trauma. Those symptoms we call PTSD. Now we have those symptoms start to impact human beings. Relationships with other people, jobs, their ability to solve problems. And then we start the onset of PTSD. Also, please be aware of when we talk about PTSD, there could be a delayed onset. This is very common with combat veterans. They'll come back, they'll be thankful to be back, they want to see family, friends, and things of that nature. They're doing okay, and then suddenly six months later, they're struggling with sleeping. They're struggling to be in large crowds. Especially if you're looking at, with combat veterans, if they're leaving the military. So with that in mind and understanding a quick and broad overview of PTSD, we want to understand, thank you again, because what do we do from there? The most important thing is we find a way to talk. We find a way to do it productively. We find support. So when you fund, in this case, the commissioners fund a program, what that initial awareness allows us to talk openly about PTSD, because if we can get them into a program, then there's a lot of really good support and help to help people get better. Just for your information, it's being studied all over the world, including unusual places like China. Even one study recently came out of Iran, something called post-traumatic growth. And what we're finding is in the aftermath of people being able to have the courage to face the pain they went through as a result of trauma, they are reporting this incredible transformation they experienced in the aftermath of trauma that they never had before the trauma event itself. So it's called post-traumatic growth. So when we're able to talk about things in a productive way, we're able to get the people the support and the help that they need. And so there's good news with the funding of programs that get funded from TST. Taxes can be very, very helpful with dealing with PTSD. And again, thank you very much. I'd like to turn it over to Kyle and go from there. Thanks, Kyle.
Good afternoon, commissioners, ladies and gentlemen, staff. My name is Kyle Putnam, and lifetime resident of Thurston County, born and raised here, graduated from North Thurston High School, and traveled over and got education at Washington State. Came back and did a few various things, and later on in my 20s, I decided to make a move in my life and actually kind of give back, in my mind, and in appreciation for all the freedoms that I experienced up to that point. And like many of us in this room, took an oath to support and defend the Constitution, and enlisted right over here at South Sound Center when there was a recruiting station over there by the mall. And then later on in my career as a Marine, I also took another oath of office as a Marine officer in Quantico, Virginia. My experience with PTSD stems from deployment. My So I was deployed in the Baghdad ER, and it's not something Marines train for. We don't train for medical events. We have Navy corpsmen that we rely on as the docs. Our focus is war fighting and everything that is associated with that. So without specific medical training in an emergency room environment, I found myself as a hospital liaison right there in the Baghdad ER and experienced. Experienced everything that you can imagine associated with that. Like Keith said, coming back from a deployment like that, you're a different person, and I'll forever be a different person and have those experiences with me. In my MO in dealing with that, unknowingly, it was a little bit of self-medication, machismo, pride, being a Marine, and what that means to me and what that means to what I know it means to the country and Constitution we serve. I shoved a lot of my feelings down below and away, and they stayed there for a long time. It wasn't until towards the end of my career when I was at what ended up being my twilight tour, my twilight command with Marine Special Operations Command, where I had the opportunity to kind of unpack and explore what this PTSD thing is. Didn't really know or think that I had it, had heard about it, knew fellow Marines that had gotten diagnosed. But I had the opportunity to, at that point, just start, and this was years after the deployment, just start to kind of unpack what was going on inside and help put a little bit of the chaos and turmoil into perspective and how I can move forward and be successful. I retired from the Marine Corps in 2020 and transitioned from that environment where there was support and there was a medical concern and growing resources within the command and moved back here. I reached out to our local vet center and was connected with a counselor and began kind of reestablishing a relationship with somebody so I could continue unpacking the PTSD. In that time, however, a situation occurred where an experience and stressors were beyond my ability to understand and control, and kind of a catastrophic event happened, which led to arrests and charges, and also now my involvement in the Veterans Court Therapeutic Program. In that time, I've been a member and participating in that program since last September, and I have grown so much as a person because of that opportunity. For one, those of us that have kind of worked and been in a military type structure, knowing that Judge Buckley is a military man, was comforting from the get-go. And coming into something new, there's always a hesitancy, and what is this going to be all about? So I came in with open eyes, open ears, and closed mouth, and I soon learned, first with meeting with Keith in our interview process, that this program is to support us veterans, and specifically with PTSD, as PTSD being the nexus to the opportunity to be a participant with these charges in Veterans Court. I liken it to working within a military command where Judge Buckley, as the commander, expresses his genuine concern for us as the program participants, and makes it very clear his commander's intent. and that's easy for someone like me to understand and follow. Along with that, the support staff, the staff officers that I would say, Keith, my care coordinator, Bianca Corona, have provided a solid foundation for success. And I feel, even when Keith was talking right now, there is a transformation and a different person I've become, whereas entering I was really numb and unsure of kind of where my life was going, to now there's a series of successes and they're snowballing, and every little success, because of the support and because of the motivation, every little success feels amazing. And I know I wouldn't be here today, where I'm at today, and the positive things that are going on in my life without the support of this program. Just within the last couple of weeks, I did an interview for a job, and it's just a fun summer gig out at the Port of Olympia at Swantown Marina. But as I entered that interview, I hadn't done an interview in over a couple of decades. There was the stress and the concern of like, how in the heck am I going to get through this? And I did it, knowing that I would be bringing up the situation, the charges, and the legal stuff that is surrounding me. I knew that if there was going to be any potential consideration, there was going to be communication with the Veterans Program, Veterans Court Program, and that did happen with Keith. And I knew right away that he would be straight. He would share my progress, good or bad, and be a champion for myself. So, I guess in closing, thank you for the opportunity for letting me share in just knowing that these types of meetings and your initiative and your willingness to listen and be open to someone and us that have experienced this says a lot to me as a citizen of this county, that where your goals are, and it's appreciated, and I know it's appreciated across the spectrum of folks that have kind of seen some of the same things that I have. So thank you very much.
Yeah, thank you.
Thank you, sir.
I'd like to introduce Paul.
Absolutely.
It's a tough topic, sorry. Just listen to my buddy speak. Brings up emotions, and I'm gonna try to hold them down. I'll be brief, I promise. Good afternoon to all, and thank you for having us and bring awareness to PTSD. My name's Paul George, served 30 years in the Army, recently retired back in 2019. Over those 30 years, I've seen a lot of trauma, a lot of events that contributed to my PTSD. It's severe. An advantage of being in active duty for that long, you're surrounded by personnel that are trained to recognize the signs and symptoms of PTSD. Not only do they recognize it, they support you and they encourage you to get treatment. And the programs are readily available, the resources are readily available, and it's a way to keep it under control. My problem was when I got out. Didn't have that support system, didn't have the soldiers there around me, watching me, recognize those signs and symptoms. Didn't have the knowledge to go to the resources. They're out there, I just didn't have the knowledge to know where the programs were, which ultimately culminated in a catastrophic event that, for me, was catastrophic. I lost my family for a short period of time, got in trouble with law enforcement, and ended up in the hospital. And I'm still recovering from those physical injuries today. My biggest concern and why I wanted to come here today is for those hundreds and possibly thousands of service members that are around our community right now, we'll be getting out. And without the current programs and policies and resources we have available today, they might end up like me, and no one should have to go through some stuff like that. So I ask you to please support the programs and policies that are currently in there, if you can, because it's going to make our community stronger, community better. And without the programs we have that support, our not only our veterans, but our civilians that have mental health issues, we're just doing a disservice to our own community. Subject to your questions, that's all I really have here today. I just wanted to bring it to your attention and let you know we need the programs. Our community needs the programs and support that you guys have.
Thank you, sir.
Commissioner Edwards, I don't know if you can hear, but I wanted to give you a chance if you had any questions or comments.
You know, I did. I heard both speakers. I want to thank them for their concern and services. But I know it's a real deal, and we want to do, as the Board of County Commissioners, we want to do what we can to help. So, thank you very much.
Commissioner Mejia?
Yes, thank you, sir. Thank you, Keith, really for managing such a great program and for being here today. I also want to thank Kyle and Paul, first of all, for their service to this country, and second of all, for continuing really their service. You know, it takes a lot of bravery to get up here and share your story and be vulnerable. So thank you. And really to help bring awareness to all of this. And it just, I am in awe of both of you. And I'm ready to read the proclamation, sir, Chair, whenever you're ready.
Okay, thank you, Madam Chair. I just wanted to say thank you for coming. Our goal being bringing awareness to this. That's not going to come from commissioners reading words on a page. It's going to come from stories, folks like yourself willing to share your experience. And so you're helping us accomplish what we're here to do. So thank you. And this issue, I have a very close family member who's in the category of an undiagnosed, it took 30 years for this person to get treatment. And so I understand some of the things that Keith outlined about the invisibility and the difficulty of seeking resources. And you guys outlined how some of these things weren't known, and hopefully we're moving that needle forward so everybody can reach out and get the help they need. Okay, well, with that, I think I'm ready, Madam Commissioner Mejia, for a proclamation.
Thank you, Chair. PTSD Awareness Month 2022. Whereas post-traumatic stress disorder can occur after a person experiences trauma, including, but not limited to, the stress of combat, rape, sexual assault, child abuse, bombings, accidents, and natural disasters, and affects approximately 8 million adults in the United States annually. And whereas PTSD is associated with chemical changes in the body's hormonal systems and autonomic nervous system, and is characterized by symptoms including flashbacks, nightmares, insomnia, avoidance, hypervigilance, anxiety, and depression. And whereas combat-related stress, PTSD stress among our men and women in the armed forces is significantly pronounced, given that they are often exposed to highly traumatic events for weeks, months, and even years. And whereas at least half of Americans have had a traumatic event in their lives, and of people who have had trauma, about 1 in 10 men and 2 in 10 women will develop PTSD. Whereas despite its treatability, many cases of PTSD remain undiagnosed and untreated due to a lack of awareness of this condition and the persistent stigma associated with mental health conditions. And whereas various treatments and therapeutic options are available for people experiencing PTSD, and whereas people who have PTSD can find healing, feel safe in the world, and live fulfilling lives. And whereas raising awareness of this condition is necessary to remove the stigma and to encourage those suffering to seek proper and timely treatment that may save their lives. And now, therefore, be it resolved, the Board of Health hereby proclaims June 2022 as PTSD Awareness Month in Thurston County to increase public understanding of the importance of supporting individuals who have experienced trauma and to promote identification and treatment of PTSD. Adopted this 14th day of June 2022, the Board of Health.
All right, thank you. We could,
Please come to the front for a picture.
Yeah, tell us where you want us to.
right up here in front of that, yeah. Proclamation, we'll get to the signatures finished up for you.
Oh,
Just come on in.
Oh, you bet,
I want to stand on, while we're over there.
There you go. You guys should even see. You got one this side.
Ready? 1, 2, 3. 1, 2, 3.
Thank you. Thank you for your service. I know it's a struggle sometimes.
Thanks
For your service.
We'll get those other two signatures.
Oh, absolutely. That'd be awesome. Great to see you again.
Thank you.
And the more we.
Congratulations on your success in your program.
Oh, absolutely. Thank you. Thank you guys very much.
Okay, great, yeah.
Yeah, it's amazing.
Okay. Super, thank you so much.
You bet. Okay, all right, we had a chance to snap a photo, so let's move on to our second item under presentations and proclamations. This is Dr. Abdulmalik. The item is briefing by Thurston County Health Officer on healthcare provider outreach and engagement activities. We turn it right to Dr. A.
Good afternoon, Commissioners. Thank you so much for this opportunity to update you on my efforts on provider outreach in Thurston County. So a lot of this comes, so we've been collaborating with our healthcare providers. You know, the history of the health officer is fairly strong in that regard. But up until recently, a lot of our collaboration has been around the pandemic, as well as COVID-19 vaccine. As COVID-19 moves from the foreground to the background, there's an opportunity for increased community engagement, including with healthcare providers in Thurston County. I held a summit with healthcare providers on May 16th. Several hundred providers were invited, and the event was live streamed. So in this summit, I recapped the Thurston County COVID-19 experience, gave a preview of next steps. So just the transition from following each case and contacts to looking at high-risk settings and people at high risk of severe disease. And then gave a preview also of the directions in which we're going as a county. So thinking about emerging infections, TB, STIs, immunization rates, opioid use and overdoses, as well as other challenges that I'm sure will be coming our way, and after action reports and reviews of pandemic response and preparation for the next emergency. We also shared upcoming opportunities for engagement and provided an opportunity for provider feedback. So I wanted to share a little bit of that provider feedback with all of you. So one of the big questions that we asked was, you know, of the providers that were able to participate, about 92% of them reported receiving a public health service in the preceding year. And this included 67% who accessed COVID-19 vaccines, 42% who accessed COVID-19 testing, and 25% who received disease investigation of a notifiable condition, and 25% who received technical guidance from public health, especially with regard to infection control. When we asked folks what they were most concerned about, we really looked at 6 core functions of foundational public health. The topic that folks were most concerned about is access to care in our community, with about 83% of folks citing that. Communicable disease control followed at 67%. maternal, child, and family health followed at 58%, chronic disease and injury prevention at 42%, environmental public health at 33%, and 8% were concerned about vital records, which is another function of the health department. It should be noted that we did not limit folks to the number of topics that they could select. So this showed us that we have a community of engaged providers that are really focused on direct human health and access to care. We also, in terms of setting the groundwork for further outreach efforts, we asked, what were the best ways to share public health information? 75% noted that email was the best way to communicate, followed by 67% that appreciated our communicable disease updates and public health alerts, which we released to different groups of providers via fax and email. 50% felt that the best way to share information was through meetings or webinars, 50% through social media, and 17% found the community letter as a good way to share public health information at the provider level. So taking all of this under advisement, we did share some of the opportunities for folks to continue to collaborate with us as we move forward, including an immunization work group, as well as infection control meetings. So these are meetings that are similar to those that have been completed in the past. And really what it does is it brings folks in public health together with providers and individuals, individuals taking care of people in our community. So this can include, folks working in long-term care, folks working in schools and daycares, as well as any one of a number of settings where infection control is a significant priority, and it will offer an opportunity for information sharing, as well as discussion and collaboration. So definitely more to come there. We additionally continue to work on coordinating with vaccine providers in our county. So there was a meeting on May 26th, much like the meetings that we held with vaccine providers right when the vaccine became available at the end of 2020, and through the times when vaccines were scarce and the rules were always changing. So we did hold a meeting similar in scope to those meetings regarding capacity in our county for COVID-19 vaccine administration. We also spoke about back to school immunizations with that group as well. And this was a meeting that provided an opportunity for vaccine providers to share their planning efforts, see what other providers were doing, share their anticipated challenges, and provide feedback to us as a public health department, as well as, so that definitely helped informed our strategy, which includes not just supporting, mobile teams with vaccine, but also serving as a depot for providers in our community. So as we move forward, I'm hoping to build on these meetings and others to continue to include healthcare providers as well as other community stakeholders as we tackle the pressing health-related challenges in Thurston County. And with that, I am happy to answer any additional questions you may have. Thank you so much, commissioners.
Commissioner Mejia, any questions for Dr. A?
I apologize. No questions. Thank you, Dr. A.
I don't either. I was present for the meeting that you're describing, or at least one of the ones you were describing with the medical providers. So thank you for that summary. Anything, Kurt, for Dr. A? Any questions for Dr. A on her report?
No questions for Dr. A.
Okay, thank you. Let's move forward then to item 3, opportunity for the public to address the Board of Health. There's no one in the boardroom, so can we check before I go through the scheme that we have?
Yeah, we may have somebody join us via Zoom, but
Okay.
as soon as you give us the green light, sir.
Okay, the Board of Health welcomes comments from the public at our Board of Health meetings. There are some guidelines governing such comments to ensure they are appropriate and do not take advantage of the fact that most meetings are televised. When called, introduce yourself, including the area you reside in the county. Address the board, not audience or staff. Silence your cell phones. Board of Health will not respond directly to public comment, but on an as-needed basis, the administrator will follow up with specific items. Speakers are limited to a total of 4 minutes and may not donate their speaking time to any other speaker. The board reserves the right to restrict a person's opportunity to address the meeting for good cause. No comments that are lewd, offensive, inflammatory, hateful, defamatory, or discriminatory in nature. No outbursts or comments that are commercial in nature, such as promotion of a for-profit business. Remarks about land use permits, which don't usually come up with the Board of Health, but similar matters that could come before the board on any type of quasi-judicial basis are not permitted. Finally, all materials provided to the Board of Health may be considered public records subject to public release upon request pursuant to the Public Records Act, Chapter 4256 RCW, and no electioneering comments in this election season. So with that, let's start with Colin Murphy. Are you?
That's right.
Do you have comment for the Board of Health?
I sure do.
Okay, go for it. You got 4 minutes.
So before I get started, and if you have to cut me off, go ahead. But it is regarding a land action, but it has to do with a public health issue related to that land action.
Go ahead, sir.
Go ahead, and we'll
Okay,
we'll
so
let you know if,
I've emailed Amy Davis the bulk of my comments to it's a SEPA comment period that's open for this land action. I live out in Southwest County, 83rd Avenue Southwest in Olympia, Washington. And my neighbors and I have all been notified that a determination of non-significance has been issued as far as SEPA is concerned to move 18,000 cubic yards of soil from a site in Lacey over to our neighborhood, which has very high groundwater, is a critical aquifer recharge area, level 1, which is the most critical. The interesting part of this is that soil is contaminated with arsenic, even though it's been mixed and somehow mitigated. I don't know how that works because you'll never get rid of arsenic in soil. But anyway, it's been mixed with other soils, and according to the State Department of Ecology, is okay to move over to the west side of the county here. Again, an area that has high groundwater. It's going to be residential development, 150 plus homes, and neighboring a future Tumwater School District middle school site. So for the details and all the stuff I've listed and exhibits I've included, I've emailed Amy Davis. You can get the forwarded email from Ms. Davis, but I and all my neighbors are strongly opposed to this soil being moved over to our neck of the woods for development. There's no reason the developer can't bring in clean soil. The source of the soil contamination, if you're interested and haven't been made aware of, is from the old Asarco copper smelter in Tacoma, which cast tons and tons of arsenic, lead, and many other chemicals all over our Puget Sound. And the site in Lacey that this is being moved from is in an area of moderate. So if you look at a map of that Asarco plume model, it's not the darkest color, but it's right next to it, and it's moderate contamination. And those soils tested positive for a cleanup level that needed to be done in order to satisfy ecology. Even though ecology is satisfied, my neighbors and I are not. I don't see how lead and arsenic are going to just stay put when we have such high groundwater. We have a rainy area, and really when there's no need to move this soil for development to proceed. Development will occur, and I understand that. I am not opposed to development, but I am opposed to this public health hazard. specifically arsenic, being moved across our county for no reason, other than to maybe save the developer from having to dispose of it properly. Those are my comments.
And we do have your email with your comments, sir. So I will make sure the commissioners have a copy of that.
Very good. Thank you.
Thank you so much, sir. Thank you. Josh Watson is next on my screen. Do you have public comment for the Board of Health?
I do, sir. And it's to piggyback off of what Colin was talking about. My property borders the property that the developer is planning on dumping these 80,000 cubic yards of contaminated soil on. My well head is about 30 feet from the property line, and the proposed dump site for this is going to be within approximately 200 feet. Like Colin said, this is an area with a critical aquifer recharge site that feeds all the wells in the community, to include the public utilities well at the corner of Little Rock Road and 83rd Avenue. My concern is for the arsenic and lead level, regardless of what the cleanup action plan said about mixing the cleaner soil with the dirty soil. Yeah, it's going to lower the parts per billion, but arsenic is a cumulative poison where you ingest it, it continues to build in your body, could cause serious health effects up to death. Liver cancer, bladder cancer, lung cancer, all sorts of things like that. Everybody in the neighborhood's pretty up in arms about this, and I've emailed the developer as well as the county building development center my concerns, as well as some of the other residents' concerns on this. Mainly, like Colin said, we're not against the development, but more so how the developer's going about this, almost like they have no moral responsibility toward the health of their neighbors or any care to that matter. So we would definitely ask that this gets looked into a little closer. I'm not sure about the folks in the room there, but I think any reasonable resident would not want this happening right on top of their home, where they've enjoyed fresh water and clean, fresh air for years. And then going on with the gentleman before talking about the PTSD, I too served for over 20 years as an infantryman in the Army and do suffer from PTSD. And this is really added to the anxiety that I face on a regular basis. So I would appreciate if the county actually took a lot of interest in this project and potentially shutting it down and not accepting this contaminated soil. Thank you for your time.
Thank you very much. I don't see any other names. The commissioners have heard 3 comments on this issue today, and there will be follow-up. I can assure you, I had not heard about this before today. Okay, with that, then we'll move on, I think, to our next department item, which is 2022 Thurston County Health Rankings. Marianne O'Garo, epidemiologist from Public Health and Social Services, is present to give us her annual report on these rankings and where Thurston County, where we fell on the list. Marianne, straight to you.
Thank you very much. I will bring up a presentation. Can you see that? Are you all able to see my screen?
Yeah, go ahead.
It's great.
Perfect. Thank you. Thank you all for having this annual presentation. Again, my name is Marianne O'Garo. I'm a senior epidemiologist with Thurston County Public Health and Social Services. And thank you all to the Board of Health. And we appreciate everyone who takes an interest in taking a look at where Thurston County stands in the annual county health rankings. And so today I'm going to share with you some findings from the 2022 rankings, and this includes some areas that we are doing well in our overall rankings and some areas that we might want to consider taking some time to do some additional work in. So first, I'm going to share with you a little bit about the rankings so that everyone knows a little bit about where these rankings come from and what they are built upon. So the County Health Rankings is a national ranking system that was put together a fairly long time ago now in 2011 by Robert Wood Johnson Foundation with the University of Wisconsin to take a look at if we could do some consistent measures of health across every state and every county in the nation. How might we look at health and what are the healthiest places? Because the idea was that health matters in terms of where we live, and that where we live matters and things can be modified. And when they looked at taking a set of health indicators of data, they wanted to take a look at a few things that we know from science and information that health is influenced by, that we can make a difference in. Health behavior, health services. So health services includes a range of things. It is not just clinical health care. That includes services provided by community nonprofits, public health agencies, and other types of services. Social and economic conditions, your physical and built environment. But we also do know that health is influenced by genetics and a few other factors. Those are things that the rankings do not measure because those are some things that are not modifiable. But the County Health Rankings and Rankings Project has the focus that improvements are possible. So everything that they're focused on is what's modifiable and can we use, and we need to be able to use what works, the science and the evidence and methods that local communities can take into account to make a difference. And partly what they wanted to do was be able to spark conversations, just to have a feel for what can we do to make changes, whether they're small steps or large steps. So they created a rankings model, and this model has really not changed much over the years. Certain elements are weighted. It includes a wide range of factors, not just healthcare or clinical care, because health is made up with many things. And that is a model that Thurston County and the Board of Health has embraced for a very long time. And our partner in community health improvement, Thurston Thrives, has embraced for a very long time. And the concept is, if you look at this, that the policy and programs, kind of that orangey red area that we implement, are the things that we can shape and the things that we can modify to change the health factors, all those areas in blue, that we have some control over, some things that we can modify, that if we shift or change our investments and what we are ready and able and willing to make a difference in, that we can improve the health of Thurston County. So this is where we stand in 2022. So this is the good news. We're still in the top 10. In 2021, we were ranked 8th. We remain ranked 8th. We always would love to improve. That is the goal that the Board of Health has always stated. That is what you would like to do. But we did maintain. And so that is something that in a pandemic, which is a disaster from a response perspective, with so many implications for our health and the community and all the things that are impacting our families and everything, every way of life. This is something that we are glad that we didn't lose ground, at least in this overall measure of health, this health outcome measure. That is not true for other counties. The best in the state for 2022 was San Juan County in Western Washington. The worst in the state was a very rural place in Eastern Washington, Ferry County. And health outcomes are considered today's health. Everyone today, where you stand today. The next thing I'm going to show you is a little drill down into this. So we ranked 8th. That's great. And just to share with you a little bit, what is that number 8 kind of made up of? The model goes into incredible detail, and I will not do that because people can go look online, and that website address is at the end of this presentation. The rankings model looks at things like length of life, dying younger than we'd like to see, premature death, and quality of life. That's kind of what the health outcome is made of, because we'd like you to have quality of life while you're alive. But they also had this other ranking that was really something that we look at really close. This tomorrow's health, this concept of all these areas that we have influence over today, kind of all those blue factors on that model. And this, unfortunately, is an area still in the top 10, but we moved from 6th to 9th. 6th in 2021 to 9th in 2022. So we did lose some ground in this particular ranking on tomorrow's health, kind of the things that kind of predict that health outcome measure in the future. So that is one area we're keeping an eye on, still in the top 10, still really good compared to other places, but something we have to keep an eye on. And I'm going to go into this a little bit further. So when you look at the health factors, that area we lost a little bit of ground in, what happened and where did we lose some ground? We lost a little bit of ground in health behaviors, a little bit of ground in clinical care. And if you think about what Dr. Abdimalik shared with you and that feedback she got, people are concerned about access to care. That really hits the mark of what you're already hearing in feedback. And I know you know this, but not everyone always thinks about this. As a regional medical center, that doesn't mean our residents have access to care. It just means that they're kind of in line with other counties for access to care, because other residents from nearby counties come here for access to care. Lewis County, Mason County, they also come here for slots in care, mental health care, dental care, primary care, specialty care. So when you hear those concerns about access to care, think about, even if our numbers look good, kind of, for the number of providers we may have, that doesn't necessarily mean our residents have access. And so that feedback you got, that work that Dr. Abdimalik is doing, and that work that the board is supporting is so timely. We did lose a bit of ground on the social and economic factors. That makes sense. The COVID pandemic has had so much impact on economics, food security, housing. We've seen a lot of things with housing. You talk about housing every Tuesday morning. And so those are some areas. We did have improvement in the physical and built environment a bit, so that's good. And so what do these areas look like? The measures that make up these different rankings are included on here. And I am also watching my time. But some of the areas that I wanted to share with you, kind of those areas that we have a bit of concern that we'd like to do some more focused work on, or continued focused work on, that we'd like you to consider. Adult smoking, youth vaping, which can include nicotine as well as other substances. That's an area of concern found both by this particular model and by our Healthy Youth Survey data. We really need to keep working on things involving commercial tobacco and vaping. though we've made much improvement, we still continue to see that need to focus in that area. They measure adult obesity, but that healthy weight, that food security area is something that we need to keep working on. Another area, preventive screenings, it's under clinical care. They measure mammography screening, but preventive screenings in healthcare, getting in to care for those kinds of things, because the earlier detection, if you do have something going on, what it means for survival, whatever that may be, is really important. Preventive things like that is where some work needs done. Unemployment, those workforce kind of things, those social determinants of health, we need to do some work around that. Some positive things that this model has shown, and you will note, you have helped both through the comprehensive plan investment in time, work that you have supported in both this department, CPED, other places, community partners, all kinds of places that have paid off. We are seeing improvements in better areas of physical inactivity. Those physical inactivity is going down, meaning people are being more physically active. That is great. We are seeing improvements in lower uninsured. We are seeing improvements in high school completion for this measure during this time period, and some folks going on to college, although when you look a little bit deeper, it does matter who. So those are some examples of areas where we're seeing improvements. I would say, and I did want to mention a couple things before I end, some considerations. I did include on here, just as a remembrance, something that I take great consideration of, and some advice that I think of often, and that's a quote from Billy Frank Jr. that's on his memorial is, "As the salmon disappear, so do our tribal cultures and treaty rights. We are at a crossroads and we are running out of time." And I include that for your thought for this reason. If we lose ground in that physical and built environment, that throws this model off. And so as I mentioned, we had improvements in the physical and built environment. And so all the work that goes into improving that and addressing housing will be critical. We do overall in Thurston County have some serious substance use concerns. I know you are aware of that, both from a prevention as well as treatment component. This need and what you did with Proclamation on PTSD for addressing connections, addressing those kind of needs, and addressing stigma will go a long way, and continuing to address equity, which you have invested in greatly, will make a great difference for the health of our residents. And finally, we highly encourage people to go explore for their own, because there is a lot of information and data beyond what is in this ranking system. They have added all kinds of measures for people to use and benefit from exploring. And with that, I will end and take any questions if I can.
Commissioner Mejia, any questions?
No, thank you, Mary Ann. That was a great presentation and really lays out what we need to do to go maybe to number 7 or 6 next year.
Okay, I have a question on the slide where you had the 4 different categories and kind of what goes into them. Can you tick through for me real fast the social economic, because that looked like it was weighted the heaviest, 40%. Can you just tick some of the major pieces of that indicator for me?
Yes. So if you were to look at the areas that it would make a difference. What makes a difference in that? Educational attainment, wages, employment, poverty, income inequality, social connections, those relationships, whether that be adults or children. And we know with kids, sorry, if you don't mind, if I can just share something as an example, because it also connects to PTSD.
Sure.
As you shared, and it's in your proclamation, there are many children in Thurston County who have PTSD from child abuse, sexual abuse, other things. Social connections is a protective factor. And so the social connections does so much for so many things, including mental health. Violent crime, which we currently have a much lower rate than other places. But I do know, as you know, Thurston County residents are concerned and want to make sure that we are doing programs and policies that address that so they feel safe. Injury is another area, and injury is a range of things. Accidents, suicide, which unfortunately, suicide is the leading cause of death for children in Thurston County, teens. That was true before the pandemic. That remains true. And so injury is also just accidents of many kinds. We are seeing other kinds of accidents through the pandemic, like you would see before, but bicycle accidents, those things that are preventable that people need to continue to think about. Motor vehicle accidents, driving, DUI, those things are concerning still. And so that's an area that all kinds of partners are involved in, that Thurston County partners with, and is it really important for health.
Okay, thank you, Marianne. Perfect. Okay, with that, we are at 4:32. If you're waiting for the public hearing on our health sanitary code, we'll get there shortly. Next is the Board of Health members' health-related activities. Commissioner Mejia, anything you would like to report?
I'll save my report for a later time, sir.
Okay. I will be attending for the next 3 days the Washington State Behavioral Health Conference. It's virtual, 3 half days, so I have maybe a lot to report next month, but I'll keep it short for today. And, yeah, yes.
Good.
Well, I mean, they're sponsoring my participation.
Oh, no, just curious.
Yes, as my governing board role for the
Awesome.
Thurston Mason BHO. So next is the health officer's report. We still have Dr. Abdulmalik. Thanks for taking your time. We know you are also in training or somewhere up north doing some important work. So it's time for your report, Doctor.
Good afternoon, commissioners. Yes, I am in Seattle learning the latest on tuberculosis. So that's one of the pieces of work that we do here in Thurston County. I did want to report on the other communicable diseases that we're also working on in addition to COVID. So in the month of May, disease control and prevention staff investigated and followed up on 85 confirmed and suspect cases of Campylobacter, chlamydia, cryptosporidium, gonorrhea, Haemophilus influenza, hepatitis A, hepatitis C, Lyme disease, mumps, pertussis, rubella, salmonella, and syphilis. And we continue to provide direct observed therapy to active tuberculosis cases here in Thurston County. I also wanted to give a little bit of the influenza update. So influenza rates had been increasing in the most recent week that we have data for, ending on June 4th. Flu activity, which is week 22 of the season, flu activity is decreasing. In the whole influenza season, so from the 2021-2022 season, there have been 18 lab confirmed influenza deaths in the state of Washington. I just mentioned this because because folks are wondering about influenza and COVID, and we've had many more COVID-19 deaths in that same time frame. There have been 16 influenza-like illness outbreaks in long-term care facilities as well in Washington State for the duration of the season. So here in Thurston County, we continue to be vigilant. We continue to watch for new developments. So watching monkeypox as that situation develops. We anticipate that the WHO will be meeting on June 23rd to discuss whether or not monkeypox is a public health emergency of international concern. And we continue to monitor individuals who've been exposed to avian influenza A. And with that, I'm happy to answer any additional questions you may have. Thank you so much, Commissioners.
Commissioner Mejia?
No questions, sir.
Okay, me neither. Thank you, Dr. Abdulmalik. Go figure out tuberculosis for us. All right. Next is our health officer, is our interim director's report, Kurt Harden.
Yep. And Commissioners, what I have is I'm abridging my report because most of it can wait till next month, but I wanted to report on the Board of Health expansion applications. And we have continued to have 4 applications that have been submitted for the 3 positions for the Board of Health. But again, the deadline is June 24th for applications to come in for the 3 positions.
4 total.
4 total so far that we've received.
Okay. And it sounds like if that stays anywhere in that stratosphere, then the Board of Health would get all those applications to review.
Correct.
All right, very good.
Yep.
Commissioner Mejia, any questions on that? So a big plug, folks. I've had a lot of folks ask me about the expanded Board of Health and those citizen seats, and this is your opportunity to send in an application until the 24th of June. This is it. And it's a very big deal, and it's a really exciting opportunity for anyone with experience as either a practitioner, a healthcare consumer that's had an adverse impact or felt. There's different categories. You can see them online, but there's also kind of a more wide open community group, nonprofit, business community with some described nexus to healthcare or to health and public health. So it's pretty broad, and we'd like to get a nice broad set of individuals on the Board of Health, so don't miss your opportunity. And with that, we are going to adjourn and go into a different Zoom where will be a public hearing, again for the Board of Health, regarding Article 1 of the Thurston County Sanitary Code. So we're adjourned for this month. Thurston County Board of Health, thank you.